You watch Breakfast Central or News Central. Let's bring you an update on the COVID-19 pandemic. And this time we'll take you straight to Namibia, where the country has suspended the rollout of Russia's Sputnik V COVID-19 vaccine days after the drugs regulator in neighboring South Africa flagged concerns about its safety for people at risk of HIV.
Namibia's health ministry said in a statement that the decision to discontinue use of Russia's vaccine was out of abundance of caution that men who received the Sputnik V may be at higher risk of contracting HIV, adding that it has taken SAPRA's decision into account. Meanwhile, Gamaleyas Research Institute, which developed Sputnik V, says Namibia's decision was not based on any scientific evidence or research, adding that Sputnik V remains one of the safest and most efficient vaccines against COVID-19 in use globally.
Well, Namibia said the suspension would last until Sputnik V receives a World Health Organization emergency use listing, but it will offer people who receive the first dose of Sputnik V a second to complete the immunization course. And that's exactly what is ongoing there in Namibia. They have said that there will be no use of Russia's Sputnik V, and that's what's going to happen. But anyway, let's quickly tell you what the index says about Africa this morning. According to the Africa Center for Disease Control, the region has recorded over 8.54 million cases, over 217,000 deaths, with over 7.8 million recoveries. And we can see that the numbers keep fluctuating. It goes high, it comes down, it's in between. Sometimes it's just stable. And that calls for each and every one of us to ensure that we follow the procedures. Ensure you wear your nose mask, ensure you wash your hands, keep social distancing like I'm doing in the studio, staying away from Oluchi so that she doesn't stay too close. And we're just trying to keep
But Joe,
safe
I mean,
as well.
the federal government of Nigeria has come out to say it's high time we start to manufacture or produce our own vaccines as well. And let's not also forget the third booster, I mean, that is out there now. And I mean, a lot of African countries and even foreign countries, developed countries, are coming out to say a third booster might be what we need at this point in time. But then, Joe, a lot of people are still skeptical in terms of accepting or wanting to take the vaccine. We know some other African countries where the people of those countries have not fully accepted to come out and get fully vaccinated. So that's still a challenge in this part of the continent.
That's really a challenge. And don't forget too as well that a lot of people are still talking about the after effects of taking a vaccine. But hey, it's just going to stay for a while and then you will kick back in and get back into action.